As a neurologist, I've spent decades studying the brain, its miracles, its mysteries, and sadly, its moments of failure. Stroke, one of the most devastating neurological emergencies, remains a leading cause of death and disability among seniors. It robs people of speech, movement, memory, and sometimes even personality. So when I say I was shocked by what I discovered, I mean it. It wasn't a new medication or breakthrough surgery. It wasn't a billion-dollar pharmaceutical innovation. It was a cup. Yes, a simple cup. One cup of a natural, widely available substance taken before bed, every night. And while it's not a miracle in the sense the internet might have you believe, the science is real. This cup, when combined with the right lifestyle, can significantly lower your stroke risk. Not in a week, not overnight, but faster than most people expect when consistent habits are built. But before you rush to the kitchen or scroll past this article thinking it's another health fad, let's look at why this cup matters. More importantly, let's understand the science of stroke, the power of prevention, and how seniors can take back control of their brain health, one choice at a time. Stroke, the silent thief of independence. A stroke happens when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Within minutes, brain cells begin to die. The consequences vary. Some people recover fully, while others face life-altering disabilities. The severity of a stroke depends on how quickly it's treated, the type of stroke, ischemic or hemorrhagic, and the area of the brain affected. Ischemic strokes, which account for about 87% of all strokes, are caused by blockages, blood clots, or narrowed vessels. Hemorrhagic strokes, on the other hand, result from bleeding in the brain due to a ruptured vessel. The problem is that by the time most people think about stroke prevention, it's too late. The damage is done. That's why early action, especially among seniors, is crucial. The usual suspects. Major stroke risk factors. As a neurologist, I always start with the basics. What makes a stroke more likely? Here are the well-documented culprits: high blood pressure, hypertension, the number one modifiable risk factor. Chronic pressure damages blood vessel walls, increasing stroke risk. Diabetes. High glucose levels damage blood vessels and nerves. High cholesterol. LDL cholesterol can lead to plaque buildup in arteries. Smoking. It damages blood vessels and increases clot formation. Sedentary lifestyle and poor diet. These contribute to obesity, high blood pressure, and diabetes. Atrial fibrillation, AFib. An irregular heartbeat that significantly raises stroke risk due to clot formation in the heart. Now here's where the cup before bed comes in. Not as a magic bullet, but as a tool that supports blood pressure regulation, vascular health, and anti-inflammatory balance. The mysterious cup. What is it? So what is this miracle cup I keep mentioning? It's not a potion or a supplement peddled on late-night infomercials. It's a glass of beetroot juice, simple, earthy, and surprisingly powerful. Beetroot juice contains a high concentration of nitrates, which the body converts into nitric oxide, a molecule that helps relax and dilate blood vessels. This process reduces blood pressure and improves circulation. Research in reputable journals like Hypertension and the American Journal of Clinical Nutrition has shown that daily beetroot juice consumption can lower systolic blood pressure significantly, often within just a few hours of drinking it. What's more, the effects appear to be more pronounced in people over the age of 60, the very demographic most vulnerable to strokes. The science behind the shock. Let me walk you through the clinical relevance. In one landmark study, older adults who drank about 250 milliliters, roughly 1 cup of beetroot juice daily, saw significant improvements in vascular function within a week. Blood pressure dropped by an average of 8 to 10 millimeters of mercury systolic. That's comparable to some medications. Another study showed that beetroot juice improved cerebral blood flow, the very lifeline of brain function. More oxygen and nutrients reaching the brain means better memory, sharper cognition, and lower stroke risk. As a brain doctor, I found this fascinating not because it was new, but because it was so underappreciated. We prescribe antihypertensives and cholesterol-lowering drugs every day. And yet, nature offers a potent helper that most people overlook. And here's the kicker. It works best when taken in the evening. Why before bed? Our bodies have a circadian rhythm. Blood pressure follows this rhythm, naturally dipping at night. But in many seniors, this nocturnal dipping doesn't happen. Instead, their BP stays high overnight, a condition known as non-dipping hypertension, which is linked to a much higher stroke risk. By consuming nitrate-rich beetroot juice before bed, seniors may encourage healthy nighttime blood pressure regulation. This doesn't mean tossing your medications or relying on beet juice alone, but rather adding a natural booster to your overall strategy. But wait, is it safe? Like all medical advice, this comes with caveats. Beetroot juice is generally safe, but there are a few considerations. It may lower blood pressure too much if combined with certain meds. It can cause bituria, a red tint in urine or stool, which is harmless but surprising. People with kidney stones should avoid high oxalate foods, including beets. Always consult your healthcare provider before adding anything new to your regimen. What if you don't like beets? Good news! The nitric oxide effect isn't exclusive to beetroot. Other nitrate-rich foods include leafy greens, spinach, arugula, romaine lettuce, citrus fruits, pomegranate juice, celery, and carrots. Tart cherry juice also supports anti-inflammatory pathways in sleep. These can also be turned into nighttime smoothies or teas to support vascular health. Beyond the cup, stroke prevention for seniors. Let's zoom out. While that 1 cup of beet juice, or similar alternative, is powerful, it must be part of a bigger prevention picture. 1. Track your blood pressure. Religiously don't guess. Measure. Invest in a home blood pressure monitor and log readings twice daily, once in the morning, once in the evening. Share this data with your doctor. 2. Eat the brain protective way, the DASH diet. Dietary approaches to stop hypertension and the Mediterranean diet both reduce stroke risk dramatically. Prioritize leafy greens, berries, whole grains, fatty fish, olive oil, low sodium intake. 3. Move more. Even 30 minutes of walking per day reduces risk. Add strength training twice per week and stretching daily. 4. Sleep well. Poor sleep is linked to higher blood pressure, AFib, and stroke risk. Aim for 7 to 8 hours per night. That cup before bed might even help. Beetroot and tart cherry juice may improve sleep quality. 5. Stay mentally active. Puzzles, reading, learning a new language, or playing music. These stimulate blood flow and neuroplasticity. Cognitive decline and stroke often go hand in hand, so protect your brain actively. 6. Stay socially engaged. Loneliness is a health risk. Seniors who maintain social ties have lower rates of stroke and dementia. A note on medications and supplements. Many seniors are on multiple medications: blood thinners, cholesterol meds, antihypertensives. Always check for interactions. Some supplements, like magnesium, coenzyme Q10, and omega-3s, may support stroke prevention, but shouldn't replace prescribed treatment. Never stop medications without consulting your physician. So, should every senior drink a cup before bed? Here's my expert take. If you're over 60, have high blood pressure, or simply want to take better care of your brain, 1 cup of beetroot juice before bed may be a powerful ally. But it's not about the juice. It's about the habit, the commitment to doing small, manageable things daily that collectively protect your brain for years to come. This cup is symbolic. It's about choosing prevention over panic. It's about honoring your brain and body with what they truly need. Final thoughts. A neurologist's honest advice. I've seen too many seniors devastated by strokes that could have been prevented. I've held the hands of patients struggling to speak, walk, or remember their grandchildren. And I've counseled families who ask, Was there something we could have done? Yes, often there was. So if you're reading this, please take action. Fill your cup, literally and figuratively. Whether it's beet juice, tart cherry juice, a green smoothie, or just a glass of water with a reminder to take your meds and check your blood pressure, it matters.